We had an existing kiosk at the time that had been years in the making, was very clunky. Any kind of edits that we needed to make, if we wanted to change our forms, it was a long, drawn-out, expensive process. It was not working for us. So we contacted Royal, and they, again, they share that then mentality of like, well, yeah, anything can be done. We just have to figure out how to do it. So we started having meetings with them. We showed them what we had and where we wanted to go. In these meetings that we had with development meetings with, I brought GSRs, that's our front desk people, and asked their wish list, what would we love to have in this program? And and they came up with all kinds of ideas. And they would come up with things that would make their job so much easier and what the patients want. So some of it was not to have to answer the same questions, depending on the modality and because of the meaningful use for ethnicity, we had to ask that 2 or 3 times, and we didn't have a way to have that logic built in that if they answered it once, boom, it would populate those fields, So Royal has done a great job, and we're there now. Coming in and doing this check-in process, before you would have pages and pages, and you'd have to handwrite, then the front desk would have to data entry, and they couldn't read everything. The whole reason we first went to a kiosk was so that the data was clean. We thought that if the patients put it in, then there wouldn't be any errors, and then our billing would be clean. And then it kind of morphed into something more. We could use that to ask all the pertinent questions that we need. The patient throughput, staying on schedule, I think that's been a huge part of our success with Royal. They've just having that kiosk, those patients checking in, the ease of it, any changes, and what we've done too is gotten the feedback from the patients, and Royal being receptive to the changes. Poor things. We were like, well, ask this question. No, take that off. No, let's do this. Our time at the kiosk has dwindled down. Originally it was like 12 minutes. Now it's down to less than 2 minutes that those returning patients. Actually was looking at comment cards. We ask patients to fill out comment cards, and a few of these comments I'm getting back now is love the check-in process, love, the application.